Most of my female patients, they ask me, Nico, how will I know when I'm in perimenopause? Is really a set of symptoms that most women experience where typically all of a sudden cycles start becoming irregular, night sweats, hot flashes, changes in mood and behavior, irritability, anxiety, insomnia, all sorts of things as hormones start to fluctuate. Perimenopause, typically is again a stage in a female's life cycle. So I kind of try to chunk these out in really like 3 stages. So there's pre-menopause, which is just a young female cycling regularly, having normal periods and all that sorts of stuff, ovulating, this, that, and the other. And that period of life, extends from, early puberty age to, depending on the lady, upwards of 40 plus potentially. Usually by 45 or 50, it's kind of over and done with. But so the vast majority of the first half, so to speak, of a female's life is spent in this pre-menopausal stage where she is cycling regularly. More or less, her hormones are relatively stable. And, if she's otherwise healthy and well, she's got her 2 halves of the cycle, right? Her follicular half and luteal half and all that good stuff. Okay. So first and foremost, I believe in the hormone replacement therapy world, those women were like not even someone we would take care of ever, right? It was almost always those ladies were just taught to suck it up. If something's really bad enough, we'll give you birth control. And we don't do that anymore either. Okay. So remember, bioidentical, specifically hormone replacement therapy, which is just actual hormone replacement therapy, right? We don't call progestins or conjugated equine estrogen. We don't call those bioidentical hormones because they're not hormones. They're hormone-like substances, okay? Bioidentical hormones are legitimately hormones in the greatest of sense, right? Anyways, let me get off that stump speech. So again, pre-menopause, kind of the first half of a young female's life leading into perimenopause, which is, it's kind of like purgatory, right? We're in this very weird position somewhere between, 40s to 50s. Again, the age is not very determined in the sense that it's not like you just hit 55 and all of a sudden you're in perimenopause, or 45 and you're in perimenopause. It can happen at many different times in a female's life. It could happen even in the late 30s, but nonetheless, perimenopause is really a set of symptoms that most women experience. It can correlate with some blood work as well, certainly, where typically all of a sudden cycles start becoming irregular. So that's one sign of perimenopause. So for example, oh, Nico, I've always had a cycle. It's always been 28 days long, blah, blah, blah. And now all of a sudden I skipped like 2 or 3 months. And then I bled, and then I had kind of a normal cycle, and then it stopped again for a month or 2, and it came back. That's one of the first, I think, very obvious signs of perimenopause. On top of that, we can also have some really nasty symptoms of perimenopause, and those could be things like night sweats, hot flashes, vaginal dryness, usually coming in kind of the later part of perimenopause as we enter into menopause, which I'll get to here in just a second. But again, those are kind of like telltale signs, like kind of the gold standard symptoms that we would be looking for if a woman might be in perimenopause. And then obviously there are a lot of other things that can coincide with this: changes in mood and behavior, irritability, anxiety, insomnia, changes in weight, right? Usually weight gain is what we're going to typically see. We could see changes in skin and hair and nails and all sorts of things as hormones start to fluctuate. In perimenopause, remember, what we're typically experiencing, what we're going to start seeing is where we used to have at least if you're a healthy female, very, very, very stable hormone levels. Now they go up and down, they peak and then they drop and so on and so forth, but they're very stable in the sense that they occur the same way, relatively speaking, day in and day out, week in and week out, month in, month out. Now, all of a sudden, what we're going to start seeing is estrogen, especially, becoming very erratic. So rather than, we have estrogen kind of peak and then drop, and then as that's dropping, progesterone peaks and then drops. All of a sudden, your estrogen starts kind of doing a roller coaster effect, right? Where it's, it could be super, super high. It could be 400 or 500 if we checked an estradiol, like on the serum. It could be extremely high one day, and then the next day we check it and it could be 2 or 3 or 0. That's how wild estradiol can be, especially in early perimenopause. Unlike progesterone, which again typically also has a peak and a trough and these nice stable levels as the weeks and months go on. In premenopause and perimenopause, progesterone really starts to just drop. So progesterone rarely has significant fluctuations in perimenopause. It is really estradiol that is starting to have very significant fluctuations, much more significant than the progesterone. So in many ways, we are in a state of relative progesterone deficiency in comparison to estradiol. So our estradiol, it's not to say that it's sufficient, right? Because in many days and many weeks, it might be quite low, or in many minutes and hours, it could be quite low, and in other hours, it could be quite high. But what we're getting ultimately is that we, generally speaking, have a slightly higher level of estrogen overall on average than we do progesterone. And this is where we start getting issues when it comes to temperature regulation. So both progesterone and estradiol, these beautiful female hormones, they both kind of co-regulate both, by the way, male and female temperature regulation, thermoregulation. They have vastly different effects on mood and behavior. Remember, progesterone is calming, relaxing. It's a little bit more inhibitory. Estradiol is very excitatory and stimulating and all that sorts of stuff. So, of course, we can also even see changes in libido and whatnot. But perimenopause is a very, very, very difficult phase of life. And of course, I don't need to tell you that. My female patients could tell you that. It's extraordinarily challenging. It's kind of shocking how many marriages I think have been destroyed during that phase of life in perimenopause. And I'm not saying this is the female's fault. I'm just saying, we have a very unfortunate set of circumstances where the wife, God forbid, is going through perimenopause. Her personality and mood and behavior were very stable, and now they're becoming a little bit more erratic, and her poor emotions and things are labile, and the husband doesn't know what to do. And it feels like it's kind of this outside force coming into their marriage where really it's just, look, this is just a phase of life. This is just a hormone thing. And this is why I'm so passionate about hormone replacement therapy, because seriously, it can prevent what I believe to be totally catastrophic and tragic things happening within a marriage and relationship, and just not even just intimate relationships, but friends and family members. It can keep a lot of those terrible things from crumbling. And these poor women, these poor patients deserve that, seriously. And amongst all the other amazing health benefits that providing hormone replacement therapy provides for a female, just that very fact that, again, the fabric of their relationships can just be pulled apart over what is just unfortunately, but normal biological point in a female's life, which is perimenopause. So, think about all of a sudden you're not sleeping. You're not getting restful sleep at the very least, right? I have a lot of my female patients. One of the most common complaints I'll get when a woman is entering, especially into perimenopause, is they're just not sleeping. And I might ask them, well, Betty, what do you mean by you're not sleeping? Because you said you get 8 hours. But if you dig deeper, she might say, well, Nico, I think I sleep 8 hours, but honestly, I feel restless. And when I wake up, I feel drained, like I feel fatigued, right? So they might not be entering into the deep cycles of sleep that they need to be entering into. But many women are, again, experiencing what is just insomnia. They wake up and it's almost always around, that kind of late part of the morning, let's say 3 or 4 a.m. They're suddenly being awakened, where their progesterone would have typically kept them, again, in a relaxed and inhibited state where they can get nice deep rest. All of a sudden their cortisol spiking, and without anything to kind of block it, so to speak, and they experience this annoying wake up effect, and it's really difficult to fall back asleep. And then, of course, the worst part is they wake up feeling anxious. That's something that, again, for a lot of my female patients is new. And it's not to say that these females don't experience anxiety in other points in their life, but it might be so specific that, like, Nico, I've never felt this way, but I wake up and I feel anxious. Like I feel a dread almost, which is, again, it's fascinating to hear this stuff because, again, some of these women are just, their whole life they've been very stable and everything's hunky dory. And now all of a sudden it feels like the wheels are falling off the wagon somehow. And so again, these are common things you'll hear from some of these ladies. And it's just a no-brainer. I tell most of my female patients, they ask me, Nico, how will I know when I'm in perimenopause? Because there's really not a gold standard diagnosis of this in the sense of like, I can't draw blood work and just immediately be able to say, oh, Betty, you're in perimenopause. It's really a culmination of symptoms and some lab reference points that we could kind of assume that likely this is all pointing to perimenopause and age and all that stuff. But anyways, I tell my female patients, it's like love. You'll kind of know it when you're in it. And they kind of laugh. And then years later, they'll be like, oh my God, Nico, I know I'm in perimenopause. And I asked them, well, how do you know? And they said, it's like love. I just fell into it. And it's that kind of thing. It's that significant for most women. There are, by the way, a handful of women that I have in my clinic, and many of my colleagues have expressed this. There are females who, I'll be honest, they kind of breeze through it. I don't know what that is. I don't know if maybe their hormone levels are just not that erratic, or maybe they don't have great hormones anyway. So it just kind of carries over. But nonetheless, practically every female, if you really dig deep enough, they will have one of those several symptoms that I mentioned to you, a common complaint of some sort. And again, they might not tie back to perimenopause. They might just say, oh, well, I just deal with some insomnia. Well, when did that start? Well, it was probably a couple years ago, when my cycles became irregular, I stopped having cycles, that sort of thing. So again, perimenopause can last for years. It can last for a couple of years. It can last for 3 or 4 years, 5 years. There's again, no like set range, so to speak. So it's something that we are very close with our patients with, and you should be, right? You should be very detailed in terms of how you approach perimenopause with them, and what are the signs and symptoms that we're looking for, and what are the goals that we're attempting to achieve, and how do we go about doing that. Thank you so much for checking out this clip and tuning in. I hope you enjoyed it. If you really liked it, I definitely recommend that you click here to watch the whole entire video where I go into much more detail. Thank you again for joining, and I'll see you there.